Hi, this is Rakesh, physical therapist with Hands On Physio, and thank you for visiting our website, thehandsonphysio.com. Now today, you may be looking for exercise or a solution for your neck pain, or maybe you're having some pain in your upper shoulders. This is a very common problem nowadays, and a lot of people have been calling us and coming in for visits for this type of pain. Some people are also coming in with pain that is starting the neck but then radiating down their arm. And all of these pains are related. Usually they stem from neck problems. So that's why I kind of bunch them all together: neck, upper shoulder, and then some people with arm pain. Today, I'm going to go through a few exercises that should help with relieving some of the neck pain and tension. Um, but understand that if you have pain radiating down your arm associated with neck pain, then you do need to come in for a detailed evaluation because most likely that's nerve pain and that needs a special type of assessment, evaluation, and treatment. Okay. So having said that, let's talk about why people are getting so much of neck pain nowadays. And I would say the number one reason is the electronic devices that we use. Whether it's a laptop computer or a phone, we're always keeping our neck and our head in the wrong position. Our shoulders are always forward, and this causes so much stress and strain on the muscles of your neck that eventually they start bothering you, and then people don't realize it, but things get worse month after month, and eventually it blows up and there's so much pain that you can't even sleep. We've been getting a lot of calls about people or from people who work on computers all day and they wonder why their neck hurts, and I just look at them and I'm like, I think it's the kind of work you do and the kind of position you sit in. All right, so before I show you any exercises to relieve neck pain, understand this. I think about 50% of getting better when you have neck problems is sitting and working in the right posture. So if you look at me from the side and if I'm sitting like this, there's going to be a lot of strain on the muscles in the back of my neck and my shoulders because of the way I'm sitting. But if I sit up straight with my neck in good posture and my shoulders back, now things are aligned better and the muscles will tend to work better and the pain should get better. All right, let me show you a few of the other exercises that we have been doing with patients who come in with neck pain. Now understand this, this is not a one size fits all, okay? I mean, for most people with just general neck pain from sitting in wrong position, these exercises should be helpful. If these exercises do not work, more than likely you have to come in for an evaluation where we will do a detailed assessment to find out exactly what's going on with you and exactly the kind of exercises that will help you get out of pain. You can easily go to YouTube and look for exercises for the neck or even for the shoulders. In fact, some people say that just doing this exercise or that exercise might help you, but that's almost never the case. There are certain exercises that help certain conditions, certain movement patterns, and certain exercises that may not help or even make it worse. So you need to know the difference between that, and the only way to tell the difference is if you do something and it doesn't help or it's making you worse, you need to stop right away, come on into the clinic, give us a chance to go through a full evaluation with you and set you up with the exercises that will actually make you better and keep you better. All right, so let's talk about some basic neck exercises. And the first one that I give most of my patients because they spend most of the time in what's called a forward head position is chin tucks or neck retraction exercises. Okay, so what we do is we have the patient sit up straight, and then if you want to, you could keep a finger on your chin just to kind of remind you how this exercise works. And how it works is you got to tuck your chin straight back. And you repeat that a few times. You want to go as far back as you can, but you got to keep your eyes and nose pointing straight. So none of this, and no up, straight and back. That's a very important exercise to do, and it's actually it might actually help you even if you think it's not doing anything right away. Some people tell me when they retract, they feel a pull in the sides. but that's normal, especially if you've been in this position all the time. If you start retracting, it's going to stretch some muscles out, so don't worry about that too much. Another good stretch is a stretch for the muscle up here called the upper trapezius. Now, the way to do that is you could maybe sit on any chair, okay? And I tell people to maybe anchor one side down, so that way this shoulder is anchored down onto the chair, and then you can use your other hand to stretch to the side. Trying to get your ear to your shoulder, one side. You hold the stretches for about 10-15 seconds, and then do the other side as well. You may find that one side may be tighter than the other side, so you may be able to go all the way on one side but not as much on the other side. In that case, focus on the side that's tight and try to loosen up as much as you can. Another exercise you want to do is what's called shoulder rolls. Now, when you roll your shoulder, you don't want to roll forward. Remember, most people already roll forward. We don't want that. We want to roll your shoulder back. Okay, so up, back, and down, up, back, and down, and kind of roll it that way. So if you're working on a computer all day, doing a few exercises like a chin tuck, or maybe a stretch, or maybe a shoulder roll, every couple of hours, getting up and moving around should help you a lot. And if you don't get better, come on into the clinic. Let us work on your shoulders, let us work on your neck, let us relieve that muscle tension, show you some exercises that you can do to get you on the path to recovery. It was great talking to you. I hope to see you sometime soon.